Hi everyone, this is Alana here. It's week 12. It's pretty crazy. I feel like we still kind of have like a little ways to go, but I feel like it's going by pretty fast, so that's good. So for this week, actually, as a quick reminder, I'm interning at Gateway to Success, and it's a behavioral outpatient program that provides individual therapy services and group therapy services to people who have domestic violence issues, mental health issues, or substance abuse issues. And then a big majority of the population that we serve are people who are on probation or parole. So their group therapy or individual therapy classes are kind of mandated by probation or parole. So that's kind of what's required from probation or parole. And that's not all of our population, but is a huge portion of it. This week I kind of wanted to talk about the group I'm covering. I'm actually covering two groups on Wednesday nights, one at 5:30 called DBT Skills, and then another one that same night on Wednesdays, 7:30, called Thinking Matters. And I think I've talked about Thinking Matters a little bit because I did have to cover it for a few weeks by myself because the clinician had left. And he's the clinician that usually does these two groups on Wednesday nights, left again, so now I have to do, and he's going to be gone for a few months because he's in the military, so I have to do DBT Skills this time as well as Thinking Matters. And so I've talked about Thinking Matters a little bit. It's a more of a cognitive-based therapy group. It utilizes a lot of CBT skills, so we teach the clients a lot of CBT skills, and the clients in those in the Thinking Matters group and DBT, it's not just people who just have substance abuse issues or just are in the domestic violence program. It's people just that basically just have negative thinking patterns, or anyone that's just been in and out of jail, stuff like that. But I feel like it does work well with people who have substance abuse issues. It kind of teaches them how to cope a little bit better and deal with negative emotions in a different way other than turning to drugs. And same thing with people who have domestic violence issues. I feel like the DBT skills class and the Thinking Matters, which utilizes more CBT skills, is good for people who maybe have conflict or have a lot of problems in relationships. They don't know how to communicate too well. So I feel like those are good classes. I wanted to talk a little bit more about the DBT skills class. So like I said, I mentioned the Thinking Matters class before because that's the one I've had to cover before. But this DBT skills one is interesting because I didn't really know too much about DBT until I started interning at this agency and until I started sitting in on this class, and then definitely now that I'm covering this class. So DBT is a form of, obviously, it's a form of therapy, but it's derived from cognitive behavioral therapy. So it's a form of that, but just with like how I like to call it, like a few little twists and just a few little components. There's like 4 components to DBT that are super important. The first one is mindfulness, just to be aware of like where you're at, the here and the now, to be mindful and aware of what's going on in your present life. And, especially all these negative thoughts coming into your head, just to focus on one thing at a time. They say, I've kind of done some research on mindfulness now that I've been doing the DBT class, and they say people who are more mindful and who practice mindfulness like a few times a day, like do meditation and stuff like that. And not even just like, sitting on the ground doing meditation, even if it's just during a certain activity like walking, going for a walk, or maybe when you're doing exercising or yoga where you're just focusing on that specific activity and where you're focusing on your 5 senses, like hearing, touch, seeing, and all that, and you're not focusing on like these outside thoughts that are trying to come in your mind or getting distracted by other things. You're just focusing on really what's happening around you. And I just think that's a really cool concept, and I think a lot of people could benefit from it. And then there's also I don't think these are mindfulness is definitely the first one. There's interpersonal effectiveness, emotional regulation, and distress tolerance. And it would take me a while to explain the rest of them, but I don't think that was in order anyways. And then, so basically the difference between DBT and CBT is DBT, it focuses not just on change, where CBT is definitely change focused. It wants you to change your negative thinking patterns, to have you recognize cognitive distortions, whereas DBT focuses on acceptance and change as well, which is kind of two conflicting principles, if that makes sense. But so basically it wants you to accept who you are and what you've done, also with trying to change maybe the negative things. So I guess just give me feedback on that, and regarding if you've ever used DBT before, or if you've ever heard of this. I've heard of it a little bit before this, but not too much. So just give me your feedback and let me know of any questions you have. Thank you. Bye.